I want to talk to you a little bit about a webinar that I attended last week. I love the technology of being able to do some CE in the evening for half hour, an hour. I think webinars are a great way to stay current, and I've been attending a lot of webinars specifically on all of the oral systemic stuff because I'm still working on that model. Anyway, quick comment about the formats. A lot of webinars are just audio, like call-in and stuff. And recently, I bought some software that will allow me to video record side-by-side Skype conversations. And one of the things that I'm wanting to do going forward in my website, because I think it's vitally important for me to be bringing you new graduates who are doing things correctly and becoming entrepreneurs. And I thought, what would be easier than just doing some short Skype interviews and then archiving those on the website so that they're readily accessible. Anyway, that's off topic. So anyway, I go to this webinar, and it's about this whole oral wellness thing. And so I titled this "The Failure of Preventive Dentistry." And I can't think of anything in my lifetime as a dentist that has failed more miserably than the concept of preventive dentistry. There is as much or more disease, dental decay and periodontal disease, that I've seen in my lifetime. Okay, there has been zero progress. Now, it's for a multitude of reasons, as to why, which I'm not going to get into, but preventive dentistry is still a concept in many people's mind. So I'm on this webinar, and there's a doctor calls in with a question, and he says, I have a patient that has bleeding, pockets, angry tissue, blah, 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 but there's no calculus. There is no calculus anywhere. And I'm completely, bumfuzzled by this, strange case. And I'm like, wow, the guy didn't know what to do. And I'm like, okay, oral DNA, there's stuff going on. So anyway, here's the brief point that I want to make today for you to really understand the difference in what's emerging. This doctor that called in was trained under the mechanical model. And there are lots of dentists. The dentist whose practice you may buy or become associated with may be locked in on this. That's why you need to know this, okay? So periodontal disease to them is a mechanical irritant. It's like a splinter in your finger. Calculus causes periodontal disease, okay? That's old school, man. That's couldn't be further from the truth. But last week, I hear this guy call in. I'm like, dude, you are like, okay, here's the medical model. This is the model that I'm going to be unveiling here down the road, the end of this year. Something very, very cool. That addresses the bacteria, okay? It doesn't matter. If the gums bleed, there's an infection. It doesn't need calculus to be infected, okay? Anyway, that's beyond the scope of this presentation, but it just came home to me that you need to know that there are two models that people have been trained in. Most have been trained in the mechanical model. Every time I see a hygienist who is using a Cavitron with water irrigation, I'm like, wow, what a lost opportunity that they don't understand that the addition of an antimicrobial agent as an irrigant changes the outcome profoundly. When you use water, all you're doing is setting up a huge bacteremia. Okay, but anyway, that's outside the scope of this. But as a young dentist, what you need to know, this is huge. Your hygiene program is a 1/3 component of your practice. Okay, so you want to be an entrepreneur, you're going to have to know what this 1/3 is. And so you have a mechanical model, the medical model. Here's the disconnect. This is the disconnect today. This is why I have no question in saying preventive dentistry is a joke. 75% of people think that dental disease cannot be prevented. oral disease is one of the most easily treated. This isn't Ebola, okay? This is like super easy to treat, okay? This is an insurance statistic. Only 3% of patients are under active perio treatment. But 70% of adults have some form of perio. You see a gap there? And 5% of people floss daily, when our conversation for decades has been, you need to brush, you need to floss, and you need to cut back on sweets. Okay? So you understand the definition of insanity. It's doing the same thing over and over again, expecting a different outcome. And dentistry, as far as this topic is concerned, has been insane in having this conversation over and over again with these types of statistics of 5% people flossing. Okay, so we need to change the approach. And anyway, stay tuned. I'm going to give you the approach. It's very cool, cutting edge.